summer season now in full swing. Up to 85% of women dread baring their legs in the summer sun. Well, I've come here to the Cadogan Clinic in Sloane Square to find out the latest revolutionary cellulite treatment that tackles this naughty little problem.
This is the laser that would be placed exactly in the area of the cellulite. So it will go under the skin in the area where the fatty tissue is and also the fibroreceptor, and helps to release the receptor and melt the fatty tissue. This way the skin would become a lot smoother when the procedure finishes.
What is cellulite?
It's really the uneven appearance that you see on the skin, and it's called cottage cheese or orange peel. And there are three elements of it. There is a thin skin, there's fatty tissue under the skin, and then there's fibrous bands that really squeeze this fatty tissue and make it protrude and cause this lumpiness.
Who gets cellulite, and most importantly, why?
Unfortunately, everybody gets it. So really, even if you are slim, you can get that. There are quite a lot of genetic factors. Diet is very important, and exercise, and also sun exposure, sun-damaged skin, and so on. So we really cannot escape it, but we can now treat it.
What are the effective treatments? Because we've come here to reveal what the celebrities, and I think the public should know, what are the treatments that really make a difference?
So what we would definitely like to discuss, and we're so excited about, is this first surgical treatment. It's actually a minimally invasive treatment, and we use a device called Cellulase from Cynosure. This is a fantastic treatment. It's FDA approved, so it has gone through all the proper processes, and it's the first one of its kind to actually permanently treat the cellulite. It's a very clever laser that goes under the skin and helps to melt those fatty lumps and also release those strands that cause the cellulite.
Is this treatment painful?
Well, you know what they say, no pain, no gain, but I do make really an effort to make it as comfortable and experienced as possible. We use anesthesia, local anesthesia, and the patient is able to mobilize immediately afterwards. So it's usually, yes, the pain is well controlled.
That's fantastic. I mean, we've heard so much about cellulase in the press and media, and I've certainly seen it on a few shows myself. So tell our viewers out there who invest lots of money in cosmetic products, and I am one of them myself, what really combats cellulite? What's your final tip?
I think a combination is very important. So you definitely need to put the exercise, and you need to look after your diet. There's no way around it. But there are stubborn areas that really can do with the help of cellulase.
Well, that's fantastic, Ms. Cavoni. Thank you for taking the time in your extremely busy clinic to talk to us. Thank you.
Celebrities who have surgery, it's absolutely fine, but they should admit it.
If they want it, and then it makes them happy.
If I knew I could operate on myself, I would do it right away once I start having a turkey neck.
Katie Bryce, I think she does it terribly wrong every single time.
Well, fresh from the offices of Miss Cavoni, I'm now talking about celebrity style skin with Dr. Justine Hextall. So, Dr. Hextall, we've just been talking about cellulite, which is the bane of all women. But what other skin issues are there that people complain about or look for remedies for? Talk to us about those.
If I was to name my top three, I'd probably say acne vulgaris, I'd also say stretch marks and skin pigmentation.
Whilst we understand that scars can never be permanently removed, what are the options for treating them?
Well, first of all, it's important to differentiate between post-acne redness and actual scarring. So many people get very concerned, they've got a lot of redness to their skin, but in fact that will naturally fade in time. You can, for example, use a laser to reduce that redness, but it will settle down. I would recommend in that situation maybe using a silicone gel, for example, Kelacote, which I use, and that seems to soften any scars and reduce any redness at the same time. And that's something you can do quite actively at home for yourself. If you still have marked scarring, and people can get quite raised scars sometimes, we can inject them. Sometimes we can actually remove them, or we can use techniques, for example, like dermaroller, or injecting skin boosters, for example, hyaluronic acid, to try and lift some of the scars. So there are many things that we can do actually now.
Every time we seem to open a magazine or watch a TV show, we see an array of yummy mummies with flawless skin. Are we missing a beat here? Or what's the trick? What's the secret to this flawless skin?
Probably what they're doing is they're treating the stretch marks. So during during pregnancy, for example, they may be using topical creams. I like Keeler Stretch. It's a cream which does seem to sort of help and certainly reduce redness with stretch marks. Also, there's evidence that if you put a lot of weight on quickly during pregnancy, you're probably more likely to develop stretch marks, or indeed, the later your pregnancy goes on, the more likely you are to develop stretch marks.
So as Dr. Hextall has just explained, that whilst no acne scar or stretch mark is permanently removable, there are lots of treatments and options out there. The key is finding the right advice and the right products to suit you.
You have to eat well, you have to sleep well.
Working out, I found that that's really helped my skin and tone up my body.
All these amazing catwalk models that you see, what they put in is a clean diet. That's the basis for their beauty.
We all read about lots of celebrities having cosmetic skin injections and fillers. There's a right way and there's a wrong way to go about doing that. I've come to Harley Street to talk to Dr. Ayubi, who's going to be guiding us through how to go about injections the safe way. Dr. Ayubi, how do we achieve those beautiful cheeks that we often see Hollywood A-listers sport? How do you achieve that?
There are different means and ways to achieve well-defined natural cheeks. The old traditional surgical approach has gone, and now we use a lot of dermal fillers and Sculptra, and we are achieving a very natural, smooth results.
If we're looking to rejuvenate, for example, the forehead, what would you suggest?
The best product to use in the forehead is the simple Botox, because it works very nicely on active dynamic lines. It doesn't interfere with the facial expression, and if it's injected adequately, it should last 6 to 9 months' time.
We hear a lot and we see a lot in the media and the press about celebrities sometimes crossing what we call that tipping point. What's your advice if people are seeking cosmetic injections?
Some of the celebrities, they go to the extreme and they cross the line where they stop caring about natural beauty, which is the best way to have. And once you cross that line, once you look artificial, even with certain procedure, all your natural beauty will look artificial.
And do you have lots of patients, Dr. Ayubi, coming to you saying, I want you to give me some cosmetic treatments, doctor, so I can look like that celebrity? Has that ever happened to you?
This does happen literally every single day. And what I try to emphasize to them very clearly, they are beautiful the way they are, but if they go to the extreme and someone wants to look like George Clooney or Tom Cruise, it will be very sensible not to operate on them.
What would you do for a non-surgical facelift? We all start to experience a little bit of sagging as we age. What can we do to pick that up?
We can use some dermal fillers to enhance her cheeks. We can do some hyaluronic acid dermal fillers to enhance a little bit the lips. But if we do a course of Sculptra in 2 or 3 sessions, she could have the effect of natural facelifting without using knife or any aggressive surgery.
What are the possible risks and complications with Sculptra?
It is a very safe product. It's a natural product we produce in our body and our muscles. And if it is injected deep and in the right technique, the side effects are very minimum.
I haven't considered plastic surgery yet, but you never know.
All I'm saying to you is that this used to be my belly button.
I will age gracefully, as you can see with the grey hair already.
You get away with wrinkles, but if you have sparkling, fresh eyes, you look young and you look alive.
Nicky Clark is one of the most coveted celebrity hairstylists in the UK, respected in his industry as being the man who made hair glamorous and exciting again. What are some of the secrets behind these amazing celebrity hairstyles? Is it camera trickery or are we missing a beat?
Well, it's certainly the fact that you can actually photograph somebody well or film somebody well does play a part, but really it's not the case that celebrities are born with great hair. I mean, the fact is that they know that it's part and parcel of their career, and so they really try and keep on top of it in terms of making it look the best it possibly can.
What are the latest trends and must-haves?
If you're talking about actresses, very often the film roles that they play will dictate the kind of trends. We've seen it recently with Anne Hathaway in Les Miserables. You know, suddenly that has become a really phenomenal haircut because she had to have it cut short anyway, and now it's suddenly become this kind of haircut du jour, this pixie, this elfin look. But the biggest thing now is the fact that you can change so much. So the versatility now isn't just about going from long to short or straight to curly or whatever. It's about, you can put extensions in, you can have, you know, be ladylike 1 minute and be cutting edge the next. And we see that all the time. All of those have a relevance now. And I think it's fantastic. Wash, condition, and rinse your hair properly. That means use the right shampoo for your hair type, the right conditioner in the right places, and rinse your hair with running lukewarm water. No tipping your head back in the bath. Get the right haircut. Silly as that may sound, it's amazing how many people have the wrong haircut for their hair type and for what they want their hair to do. Use the right styling products to dry your hair, or don't use styling products, but don't use the wrong ones. Adopt the correct drying technique, even if that means finger drying it, letting it dry naturally, or using round brushes or other appliances. Use a correct finishing product. It's amazing how you can go from averagely good hair to wow hair just by using a finishing cream that gives it that great editorial and celebrity look. Make sure the colour's perfect.
So, as you can see, being a celebrity isn't always as easy as it's cracked up to be. It takes a lot of preparation and hard work to look fabulous and flawless. I hope you've enjoyed our journey of discovery with our top beauty experts. I'm ready for my red carpet moment now. The question is, are you?